Are you there? First year, all your videos should be on. We'll start the class. The name of the theory is by Sister Calista Roy. Okay, this is very important. Roy's theory. When you do master, mostly Roy theory used to come, and application of this theory is very high. Okay, so we will start up with Sister Calista Roy again, and this is her picture. This is how she look. Okay. So, introduction to is nursing is establishing itself as a scientific discipline. Okay, this is what she said. The nursing model provides the basis for selecting knowledge to be transmitted in nursing education. It is the framework for nursing practice and the direction for nursing research. Okay, so this is what Calista Roy said. Okay, it is a scientific discipline, nursing. According to Calista Roy, nursing is establishing itself as a scientific discipline. And she also believed that nursing models provide the basis for selecting knowledge and transmitted in nursing education. Okay. And also she also believed that nursing is a framework for nursing practice and the direction for nursing research. So this Calista Roy believed nursing in this way. Okay. Then if we look at the biographical sketch of Calista Roy, she was born on 14 October 1939, and she is a Bachelor of Art in Nursing. In foreign, no, during those time there is arts in nursing also is there. Okay. Then again she mastered in science in nursing from the University of California, that is Los Angeles, in 1966. Then she also mastered again. She was Bachelor in nursing arts, no? So again she mastered that one in sociology. All right. Then she became the associate professor, and she was a chairperson of a department of nursing at Mount St. Mary's College until 1982. Okay. Till 1982 she was an associate professor in St. Mary's College. Okay. So this is a little bit about her biography. Then in 1983 to 85, she did a postdoctorate, PhD, okay, fellow at Robert Wood Johnson's at University of California again as a clinical nurse scholar in neuroscience. So again she did PhD in neuroscience, okay, that is in University of California. So this is her education, and she was associate professor, chairperson in many prestigious universities. Let's come to her evolution of her theory, how her theory was evolved, how she started writing. Okay, her concept of theory was developed when Roy was graduate student. When she was just a graduate student like you, okay, she got motivated. How? Let's see. Challenged by another nurse theorist, Dorothy E. Johnson. Okay, this is also another theorian, that is Dorothy, okay, E. Johnson. She challenged her when she was a student to develop a theory of nursing. She found that Calista Roy was very brilliant, and when she was just a graduate, Dorothy Johnson, she challenged her and told her that you also have to develop a theory. Then he started operationalizing in 1968. Then she literature and debuted in 1970. Then she presented that model presentation in 1977. Okay, so she started writing this theory when she was just a graduate. You know, she did her even PhD in neuroscience, but then she developed this theory when she was just a graduate student. Okay, so what is her assumption? What is her assumption in this? She has 4 assumptions. Okay, she has 4 assumptions. She just assumed that it is a scientific assumption. She said it is a philosophical assumption from humanism, assumption based on veritivity. Okay, so this is very challenging to her, and these are the assumptions she made when she wrote the theory. Okay, so let us see these four theories in detail one by one. When she had a scientific assumption, she said that systems of matters and energy. Okay, she said self and environmental awareness, human decision, thinking and feeling, system relationship, person and earth relationship, person and environment transformation, integration of human and environment. So you will find that in many of the theory, they will relate between human and environment. We looked from all the theory that we studied before, even in model, isn't it? They said that human and environment cannot be separated. One theory said, isn't it? We see that that is the Martha Roser, I think. Which theory was it? So mostly even nursing Nightingale theory said human and environment are. If Nightingale even said if human has to be healthy, her environment has to be healthy. There should be an interaction between. If there is a healthy interaction between environment and human, then they will be healthy. That's what assumption. So Calista Roy also has assumption on many of this. Okay, when she said scientific assumption, she assumed that system of matter and energy, okay, is one that she has in her mind, and self and environmental awareness. She said that people should be self-aware, and then environmental awareness also should be there. And then she said that it depends also on human decisions how that person takes a decision on health, or otherwise. That's what she said. Then she said again, she also assumed on thinking and feeling. Then she again said system and relationship should be there. We should have a relationship with system. Then person and the earth relationship. Okay. Then person and environment transformation. Then integration of human and environment. These are her assumption. And in assumption of humanism, she said humanism should be creativity, it should be purposeful, it should be holism, interpersonal process. Okay, so humanism, because all we have is each other. That's what she understands. So humanism is because all we have is each other. We explain we only have each other. So if you are a human, you should be creativity, you should have a purposeful life, and there should be holism in you, and interpersonal process should be there. That is what she believed on the assumption of humanism. Okay, next, when she said an assumption based on veritivity, she said purposefulness of human existence. Okay, then unity of purpose of humankind, activity and creativity for common goods, value and meaning of life. Okay, these are the all assumption that she have, and she is going to write her theory on the basis of all these assumptions. Now, Roy's adaptation model, because so if anybody in exam when it comes, they will say like write adaptation theory. Okay, sometimes many of the time in masters they will not tell you to write Roy's theory. It never come like that many of the time. So the question will come like this: adaptance theory. They will twist the question and ask. Okay, so adaptation model, or when they said adaptation model, that means you have to understand, you can write any of the adaptation theory, which is Calista Roy theory is one of it. That is, this is an adaptation theory. Okay, so in this adaptation model, Roy's adaptation model, nursing is to help the person adapt to change in physiological needs, self-concept, role function, and interdependent relationship during health and illness. So she believed that if you are a nurse, your duty is to help a person to adapt. Okay, adapting. When you first come to this college, you must have find so much difficulty in adapting to be a roommate with your friend who is coming from different background, and maybe from different way of living, or even you must have find difficulty in adapting theory class from 8:30 to 5:30. Okay, it is not easy. And then the first thing you do is all about is adjustment and adaptation. Okay, when you are fluent with when you can do the adjustment and adaptation of all that, then slowly you are able to do your syllabus. Okay, so it is very important. So nursing, Calista Roy said that nurses or the nursing itself should be we should be able to help patients or other person to adapt. Okay, we should help them to adapt in which area physiological needs. We have to help them to have their self-concept. We have to help them in their role function. Okay, role function means the activity of daily living. Brush teeth, take bath, wear healthy clothes, do some exercise, activities, eat healthy foods. Those are role function. Okay, we should also help them to be in interdependent relationship during health and illness. So when you are healthy, at the same time when you are sick also, nurses should be a person who help human beings in adapting all that in terms when they are healthy also, and moreover when they are sick. Okay, that is what she believed. Okay, so she said that nursing should help people to adapt. Adaptation is very important according to her. Okay, the meta paradigm, I said when we study a theory we should know the meta paradigm. Okay, so when they ask you what is the meta paradigm of, in the previous first class I have already told you what is meta paradigm. Okay, so when we look at the theory, we have to know the theory. The theory is how did the theory explain on nursing. Okay, what is her main concept, that we have to know. So her meta paradigm of Roy's adaptation model is human being, okay, environment, health and nursing. So she stressed on this main four topic. Okay, even if you forget everything, if you remember that Roy adaptation model meta paradigm is this four, then you can write on it. You can go human being, what did Roy say about human being, then you can write. Then environment. Okay, then what did health Roy said, explain about health. Then what did Roy said about nursing. Just now she said nursing should be a person who helps others in adaptation. Okay, like that her meta paradigm, Roy's meta paradigm is human being, environment, health and nursing. Okay, on this four topic she focused. Whatever she talk, she's talking on this 4 point. Now the first was human being. Okay, so what did she say? Let's see. The first meta paradigm was human being, and in human being Roy said the person view as adaptive system. She view us, okay, she look on human being as a adaptive system. Okay, she look you are adaptive system, I am adaptive system, Pakija is adaptive system, Nilakhi is adaptive system. Like that she look on human being as a adaptive system. Okay, so adaptive system of what? Their health and their environment. Okay, she mean to say that if one person have got a very good quality of in adaptation, that's it, that's what she meant. Okay, then and their environment. So if a person is a adaptive system on their own health and on their environment also, if they know how to adapt, they will be healthy. If they know how to adapt with their environment, they will be healthy. That's what she believed. Okay, now she also said that human being is a interchanging with the environment, or she also follows the Nightingale's theory. She also take all the theories take from here and there. Okay, so she also believed that human being is what? Interchanging with the environment. If we don't interchange our feeling, our system with an environment, then we cannot exist. That's what she believed. All right. Then human being is a person, also refers to families. When she said a person, person is also a family, a person is also a group, person can be also a community and the whole society. Okay, so this is the paradigm that she have on human being. Right, you go through, you will understand. She said human being is the adaptive system on their health and the environment. Human being is interchanging with environment. Okay, so when she said a person, person is not a single person, can be a family, person can be a group, community, and whole society. But in some theories, when they say person, person is a individual. Okay, but in Roy adaptation theory, she said person is family, person is group. She address it can be community, it can be whole society. Okay, but when you read other theories, they will say that in some theories, I don't remember, in some theories, when I say a person is an individual, they will say. But you have to remember, okay, in each theory, when they say person, most of them will say it's a family, group, or community, or society. But some theories say when I say a person, it's an individual. They will say like that. So the difference you have to understand. Now, environment. When Calista Roy said environment, environment is all conditions. Okay, environment can be a circumstances, environment can be your influences that surround and affect the development and behavior of the person. When she said an environment, environment is not what she meant is environment is not the tree it is growing and there are hills around you, there are so many girls around you. That she did not mean that. When Calista said environment, it can be all condition, it can be your circumstances. Okay, the problems that comes to your life. Okay, your environment can be like your family, your society, your classmates, your NEIGHRIMS college, all that. Okay, when she said environment, she meant all condition. Okay, it may be circumstances, it can be your influences, okay, that surround you. Okay, that is how she said your environment. Okay, environment, when she said a change act, or when she said an environment, it is a change acts as a stimulating and causes adaptive responses. So when your environment is very stimulating, okay, when which is stimulating, either may be problem stimulating, either it may be influences that stimulate you, it is the causes, it all causes adaptive response. Okay, even if it is bad environment or good environment, it is all that cause adaptive response. Okay, that is what she explained environment means. Environment means what we think. It is not the definition of environment. This is Calista Roy's environment according to her. Okay, all conditions that surround you, happiness, circumstances, problem, anything that stimulate you and it causes you to adapt and respond. That is your environment according to Calista Roy. Okay, then when she said health, okay, when she said health, health is a process where he or she is striving to achieve their maximum potential. Okay, when she said health, she's not we when if I ask you what is health, then you'll give me a definition of WHO and health according to you, or health according to some other definition. But this health is according to Calista Roy, and she said it is a process where he or she is striving to achieve their maximum potential. Okay, when she said nursing, in the first introduction itself, she already have told about what is nursing. Nursing, according to Calista Roy, is an act of enhance the interaction of the person with the environment to promote adaptation. She already said, no, nursing should be a person who help others to adapt, okay, with their health and with other circumstances, okay. So now, according to Calista Roy, it is interaction of the person with environment to promote adaptation, okay. That is a nursing according to her paradigm, according to Calista Roy. Then there she said stimuli, isn't it? She also said a stimuli. She said your environment will should is a stimulating, which cause you to respond. She said, no, anything that stimulate you is your environment. Either it is a good stimulation or bad stimulation, okay. So she again divide the stimuli into focal stimuli. Contextual stimuli will look one by one, okay. When she said focal stimuli, it is immediately confront the individual in a particular situation, okay. Focal is which comes confront you, okay, which confront you. Focal stimuli for a family include needs and change within the family members among the environment, okay. When she said a focal stimuli is that which confronts the individual, okay, which confronts the individual, okay. What confronts us in our life is our family, okay, and within the family members among the environment, okay. So you have to remember as focal stimuli is immediate confront of the individual in a particular situation is a focal stimuli, okay. When she said a contextual stimuli are those other stimuli that influence the situation, okay, that influence the situation. Focal is immediate confronting problem, okay, stimuli. Contextual is those other stimuli, okay, other stimuli, like maybe there will be an example, maybe your job, your study, okay. In focal it is your family and family members, but in contextual it is other than that, maybe other situations like maybe your job, your peers, your friends, all that stimuli, okay. Residual, the third one is a residual stimuli. When she said a residual stimuli, it includes the individual's beliefs or attitudes that may influence the situation. Contextual and residual stimuli for a family system include nurturance, socialization, and support, okay. So in this residual and contextuals are like your nurture, okay, nurturance, who nurture you, then socialization and your supports. These are your contractual and residual example. In the focal, it is the immediate problem which confront you, okay. But in contractual and residuals are like especially in contractual, your job, your peer groups, all that, okay. So and in residual is your socialization, your supports. All these are stimuli according to Calista Roy, which comes to us stimuli, okay. So if people is able to adapt to all these stimuli that comes, if we are able to adapt all this, then we are healthy, okay. That is what what she believed, okay. Did you understand so far?
Yes, ma'am.
Okay, so she said human beings, she talked about how we have to interchange with environment, and she said that human beings should be nursing should be a person who is able to adapt. She said also sick people also have to learn how to adapt. Nurses themselves also have to know how to adapt and teach how people how to adapt. She talked all about on adaptation. Calista Roy theory is talking about all adaptation. Adaptation of what? Adaptation of so many stimuli that surround us, so many environment. When she said environment, all conditions, she said all condition. She explained what is her environment, okay. Good condition, bad condition, troubles, problem, happiness, everything that comes. She said if we know how to adapt to it, that's it, okay. So that's why her theory is known as adaptation theory, RAM. Roy's adaptation model, they said. Okay. Now, types of stimuli, she said, is the example is smoking. Okay. Focal is like nicotine addiction. She's just giving that this example. Okay, which confront us. Okay. When she say contractual is like belief that smoking is, if we take an example of smoking, all right, when we say a stimuli, okay, don't get confused. When she said the stimuli, she is trying to explain by taking something, that is, she took smoking. Okay, she take an example of smoking. Okay, so the focal example on smoking is like nicotine. Smoking contain what? Nicotine addiction. You will become nicotine addiction. When she said contextual stimuli is the belief that smoking is enjoyable, relaxing, part of routine. Okay, that is the they believe. Okay, then residual stimuli believes, if it is a smoking person believes about body image and weight gain with smoking cessation. Okay, so they said like if I stop smoking, then I will become I will gain weight gain, and then so many believe that they have on their image. I will not become beautiful or something like that. Okay, I will not have friends if I don't smoke. So she just take a example of stimuli by taking smoking. Okay, so the definition she already give you when she said focal, it is that things that is confronting you, immediate confronting. Okay, like your family, these are confronting. We cannot leave, we cannot forget family, isn't it? So again, she took a smoking and she tried to give you an example. Okay, don't get confused in that. Now, coping mechanism. Again, it is very interesting. If the whole textbook, if I explain from the whole textbook, it is more challenging. It's very nice theory. Okay, again, coping mechanism. Again, Roy said in regulator. Again, in mechanism, she have two. She have put 2 points. Okay, that is regulator and cognator. Actually, there is a model. We have to draw a diagram on this. Then only we get marks. Okay. Now, when she said regulator is primarily used as a mechanism to cope with physiological stimuli. She already said no. She in the beginning she said adaptation means what? To adapt with physiological adaptation. Okay. If you look back at that, she said adaptation. When we say adaptation, is that it's not only adapting with your situation, with your condition. When she said, she already said, what is that adaptation? In the previous slide, she said, adaptation is not only that you adapt with your situations or surrounding. It is also to adapt with your physiological stimuli. Okay. So in physiological, what is regulator? Regulator means like primarily used in mechanism to cope with your physical stimuli. Okay. So we have to have a regulator, she said. So physiological stimuli. When she said cognator, used mainly as a mechanism to cope with psychological stimuli, dealing primarily in areas of cognition, adjustment, and emotion. Okay, so when you first, let us give an example again. Regulator is what? Okay, when you first go to new area, you try to adapt with your physiological stimuli. No, the place is cold, very cold or very hot. You try to adapt with that climate, and then you also have to adapt with the food pattern, and then the sleep pattern. Okay, and then how to spend your energy. Okay, this how to cope up with all this, that is your physiological stimuli. And according to her, she said all this you have to adaptation. Okay, she stressed on adaptation. Now when she said a cognator means what? Your say for example, before you come for nursing, I don't think that you have set for a class from 8:30 to 5:30. Okay, for example, continuous theory class. Okay, so this is a mechanism for your psychological. Okay, that is primarily in areas of cognition. Your brain, your brain should be, by now, I don't know, some of your whose brain is actually very good, sharp people, no, they, even if continuous class of different topic is there, they will still remember. Okay, they are already adapt to it, their cognition power is good, and adjustment in the regulator is already there. And then emotional adaptation. Okay, so you just remember, as regulator means it's a physiological stimuli which we need to adapt, and when you say cognitive, it's a cognitive adjustment and emotional, how to cope up with your cognition, adjustment, and emotion. When we see that a perceptual and processing example is selective attention, coding, memory. This is all about her theory. We will explain. I will try to explain. Okay, and then in learning is imitation, reinforcement, insight. When she said emotion is the defenses which are used to seek relief from anxiety. Okay. Then when she say cognitor system means it's a perceptual or information processing, learning, judgment, and emotion. Actually, this we there is a I don't have that the diagram. When you master, no, in the textbook it is there. In the theory textbook it is there. She will draw her whole model. She will draw, and from cognitor, from which system to how coping is going on from the beginning to the end. Okay, it explains that. Okay, so when she say emotion, that makes effective appraisal and attachment. Okay, when she said emotion, she mean that it makes the effective appraisal and attachment. Okay, so emotion, we all have emotion. Okay, emotional attachment, isn't it? If you are with some person, see, 50 of you are here for 4 years, in difficult time and in good time, sometimes you fight, sometimes you laugh, sometimes you starve together, sometimes you eat together. Now this will, by emotionally, you are going to have an emotional attachment, and when the day when there will be a day to depart from here, it will make you sad and you will cry. Okay, so that's called emotional adaptation or attachment. Now identify the modes and submodes of Roy adaptation model. Okay, identify the modes and submodes of Roy adaptation model. Now when she said adaptive modes, when we said adaptive modes, now let's come to how adaptation will take place. Okay, when she said adaptation modes, she said it's a behaviors, psychological, self-concept, role function, interdependent. Okay, so now she will start talking about how will the adaptation take place. She is explaining on the model she said. Okay, this will be explained again one by one. Now physical mode needs of physiological integrity. When she said a physiological modes, that is, our physical needs oxygenation, nutrition, elimination, activity and rest, protection, senses, fluid, electrolyte, acid, base balance, neurological function, endocrine. This is all physiological integrity that our physiology needs to adapt to some situation. Okay, when we say a physiological adaptation, physiological integration, these are all. Okay, so when we try ourselves to physiologically adapt in some situation, these are all involved. Oxygenation is needed, nutrition is needed, elimination is needed. Okay, even after you come from hot place to cold place, all of this will change. Okay, all these adaptations are changed. What you used to have at home will not be there. Some of you used to do your number 2 every day, maybe at home when you are maybe 6 o'clock, 7 o'clock. After you come here, everything changes. You know why? That is because your food pattern changes, your environmental pattern changes, and all your everything psychological change. Okay, that is because of your physiological integrity. Physical modes are already changed, that is why. Okay, even some girls, your periodical problem you will have every time you have regular. When you go to some other places, it will not be regular. That is because of your physiological adaptation change. Okay, when she said self-concept mode is that psychological and spiritual aspect of that person. Okay, need for psychic integrity. Okay, self-concept mode, psychologically, spiritually aspect of a person is there. So when she said self-concept means these are the things. Okay, when she say adaptation is not adapting of physiologically, we should be adapted everything physiologically, mentally, spiritual, everything adaptation should take place. Okay, then self-concept. Self-concept is a composite of beliefs and feelings that are a person holds about him or herself at a given time. Okay, when she said our self-concept is that self-concept is composite of what? Your belief, your feeling that you holds about him or herself at a given time. Okay, so this is a self-concept definition given by Calista Roy. So this is what I am talking about the model. Okay, so the input, control, process, effector, output. These are the stimuli. Okay, so from stimuli adaptation level it will go. Then coping mechanism will take place. It will both take physiologically, mentally, all of that it will take. Then again it will go to physiological function, self-concept, role function, interdependence. All this will come. Okay, after that you will we will go to the next level, that is adaptive and effective response will happen. Let me explain again. First you get the stimuli. Okay, stimuli is we have seen what are those stimuli. Okay, so first stimuli is put on us. When we first get stimuli, what happened? We pass on to next level. We try to cope up. Our coping mechanism will come on what? Regulator and cognator. Regulator is physiological and this is mentally, psychologically. Okay, so this coping mechanism takes place. Then we pass, after that we pass on to this. Okay, we pass on to physiological function, self-concept just now I explained. Okay, role function, interdependent, these take place. Then we move on to the next level. What is that? Adaptive has come and effective responses is there. We have to go through all these things. By now I think you are already adapt to the way of classes. You will sit and then practical you go. You are able to adapt now. Those who cannot adapt, they left and go. Yes or not? Okay, so this is how adaptation takes place. First stimuli is applied, then we pass on to this level. Then we go to this level, then adaptation takes place. Then it come back here, this is the feedback. Then we go back to stimuli again. This is on and on. That is what Roy is trying to explain. Okay, human being is always on stimuli, but then they will try to adapt and then it goes. This is our model. When they ask you about adaptation model, if you don't draw this, you don't get marks. So human system, this is all about. Okay, this is Roy's model. Stimuli comes. Okay, she said when stimuli comes, how to adapt, it depends on your behavior. Okay, so this is the behavior. See, this is physiological, self-concept, group identity, interdependence, role function, and then this is a coping process. So she already said human being is what? Is a coping system. She said, isn't it? We are human beings, she compared as a system, the whole system. Okay, you are a system, I am a system. No matter how much stimuli is supplied, we are going to cope up. That's what she meant to say. When you write a theory, you have to draw this model. Okay, see stimuli will come from here, then these are the behavior. Okay, behavior, and then all this will happen, but then adaptation will take place. That's what she meant. Okay, Now, application of Roy's adaptation model, how to apply in nursing or in your study. Okay, to promote behavior, serve as a guide to assess its members' level of adaptation. By seeing this, you can assess your own adaptation level. Okay. Then identify actual or potential adaptation problem. So what is your actual adaptation problem? What is your potential in adaptation? You have to try to identify yourself, assess yourself, and application. Okay. Or she already said nursing should be a person who helps in adapting. Okay. So using her model, you will be able to try to assess. Okay. Then she also said examining the stimuli that influence those problems. Okay, when there is a problem, there is a stimuli or triggering point. We said, okay, stimuli or the trigger point. When there is a problem is not only the problem. There are so many which trigger. Okay, which trigger. What example should I take? When one is suffering from corona, one person is suffering from corona, what happened? That suffering illness of corona is not only the problem. Stigmatization, people not trying to understand. Okay, you did not get the facility. Those are also another stimuli. Okay, those are not on all. Those are not the only. So examining the stimuli that influence those problems. In the problem, we have to find out what are those stimuli which aided. They said no. Ghav mein namak. They said like in the wound, when there is a wound, if you add namak, salt, how will it look? It will be more, isn't it? It triggers. So that we have to find out. Okay, management of stimuli to promote adaptation. Okay, so this is the application of Roy adaptation model to promote behavior. Okay, we have to all look at that. So, and then in education, how will you apply? Nursing education, you can apply. Geriatric nurse practitioner program, you can apply. You can apply on the University of Ottawa School of Nursing. It is applied. It is applied on St. Mary's College, Los Angeles. Okay, this is on education adaptation. Then in administration, a nursing philosophy, mission statement, standard of practice, job description, planning and appraisal, quality monitoring. Okay, so whenever you do research on all of this, you can use Roy adaptation model. Okay, then what is the strength of Roy adaptation model? How strong it is? Let's see. Used to analyze diverse healthcare related issues, it analyzes the individual from broad perspective. It identifies factors affecting the individual and his community, provide opportunity to understand whole human being, includes the spiritual aspect of nursing assessment. This is the strength of this model. Okay, it's powerful. Area of practice in terms of medical condition. You can apply on cancer patient. You can patient amputation, AIDS management, Alzheimer's disease. You can apply on anxiety. You can apply on chronic pain, cardiomyopathy, chronic sorrow, and then critical care. Say like when we go in community, we take one case. Okay, in master course, when we do MSc nursing, we have to, when we take a case, we have to apply one theory. So say like if my case is amputation case, I can apply because there is adaptation. Patient have to adapt to the one limb which is already amputated. Okay, cancer patient. Okay, has to adapt because have to accept, isn't it? So they can apply on it. Then area of practice in terms of medical continue. You can hypernatremia, intensive care, postpartum, leukemia, osteoporosis, pediatric, preoperative, polio survival. So the strength is very big, isn't it? You can apply in many. Okay, so it is a very strong model. Then in terms of human development, in human development, if you want to apply, you can apply on adolescent, caregiver stress. Many of your seniors are doing research on caregiver stress. So they can apply this Roy adaptation model. Okay, cesarean section, emergency, gerontology, mental health, neonates, nursing administration. Okay, so they can apply on all of this. Then again continue of human development, nursing children, nursing community, nursing families, nursing infant, palliative care, pregnancy, rehabilitation you can apply. Okay, then nursing intervention. In nursing intervention, breastfeeding, group therapy, nutrition, parenting, spiritual intervention you can apply. Then you can use in rheumatoid arthritis also. Okay, then physiological response mode. Okay, in rheumatoid arthritis, this is the how they apply on rheumatoid arthritis. They apply how they apply. That's what they are showing. Okay. So assessment of stimuli. Disease itself is a rheumatoid arthritis. In contracture stimuli, difficulty in swallowing, fatigue, inability to do daily work. In residual stimuli, what happened? Person belief, current health status. Okay, like this we have to write. Okay, when we take case, when we apply in any of case study, we have to write like this. So physical response, self-care, role function, this is the definition of it. So this is a conclusion. Roy adaptation model identifies essential concept relevant to the nursing profession. Okay, the human adaptation system is constantly interacting with internal and external stimuli, which affects individual health. It is the responsibility of nurses to manipulate specific stimuli so as to help patients achieve optimal health. It is useful in analyzing groups, individuals, and societies. It is the responsibility of the nurses to facilitate adaptation of group and person so as to enhance their welfare and well-being. Okay, so unless you are a person who understand what is adaptation and you learn how to adapt, okay, you cannot be a nurse who can help others to adapt in their situation. In adapt when they are sick and adapt when they're, when it says all conditions, he said all condition during your sick time, when you are well also. Okay, we know how to, we should learn how to do adaptation. So first of all, you have to understand what are the adaptation in which area. In physiological, there are so many things to adapt. In mental, there are so many things. When you are able to adapt in that, then you can help others to adapt to their situations and conditions. Okay? Alright. So, Calista Roy said that human being is the adaptive system. Okay? We have physiological adaptation, mental, spiritual adaptation. And nurses should be a person who have to adapt themselves and who have to help others to adapt in all conditions and all situations of life. That is what adaptation is saying. And the strength of Roy adaptation model is very big. You can apply in many cases. Okay, when you do a research, when you take a cases, you can apply. The strength of Roy adaptation is very strong. That is why in most of the exam, Roy model always comes in exam. Okay, no questions, so bye bye.
Bye, ma'am.
Thank you, ma'am.